You're listening to Rise Above, a Rogers Behavioral Health podcast, where we sit down with Rogers experts who are changing the way the world views mental health and addiction. Hi, listener. Thank you again for joining me for another episode of Rise Above. Today, I wanted to talk about a subject two subjects that surprisingly have a lot of similarities and oftentimes go together, and that's substance use and eating disorders. Now, one thing that I didn't realize until a few weeks ago is that there are quite a few similarities between the two. And with me today to talk more about that, I have Dr. Nicole Stettler, Executive Clinical Director of Eating Disorder Services at Rogers Behavioral Health, and Dr. Michelle Maloney, Executive Director of Addiction Services at Rogers Behavioral Health. Thank you both so much for being here.
Thank you.
So, Dr. Maloney, why do I have you both here today? Eating disorders and substance use.
Yeah, Andrew, I think that's a great question. Historically, traditionally, substance use disorders and eating disorders have been treated separately, right? A lot of individuals have sought out care for either their substance use disorder or their eating disorder, and then they tend to go to follow-up treatment for the other disorder, right? And as we continually see individuals that have more and more co-occurring or comorbid or combined disorders, I think it's important that we begin to treat these disorders at the same time, right? If you think about that old carnival game, whack-a-mole, right? You'd hit the head of, I think it was a gopher, or I guess it was a mole. A mole. You'd hit one and then the other one would pop up. And really, this is really trying to hit two at the exact same time, because we find that our patients get better and sustain recovery longer when they're treated simultaneously.
So is it common for people to come in with both an eating disorder and substance use?
Yeah, it can be pretty common. There's definitely, among people who have eating disorders, we know that the rates of substance use are much higher than the general population on average, and vice versa. Among people who have a substance use disorder, the rates of disordered eating or eating disorder diagnoses is also much higher than the general population. So the risk is definitely very high among both of these groups, and we certainly see that those symptoms can be present for both sets of symptoms can be present for many people.
So when it comes to substance use and eating disorder, I mean, is there a reason that these tend to show up at the same time?
I think for some individuals, it can be they're using substances to potentially control their weight, right? Like I'm aware of some individuals who were drinking and then switched to stimulants or amphetamines or opiates in an effort to control their weight, because they found when they were using, they tended to not eat or they lost weight, right? And so I think for some individuals, that can be a motivating factor. For other individuals, we know that both eating disorders and substance use disorders, individuals tend to be more on the impulsive side. And the way the brain works, I think there's many overlapping kind of characteristics of both disorders that can also spearhead why they may be in combination. I don't know, Nicole, if you would add anything to that.
No, you captured exactly what I was thinking, that I think there's kind of shared vulnerabilities, and not just with eating disorders and substance use disorders. I mean, that's what we're kind of talking about, but I think those are also reasons why we see depression, anxiety, other kinds of mental health problems also coming up in these populations as well. I think the reason why we're focusing a little bit more on substance use and eating disorders is because compared to some other kinds of disorders like depression, anxiety, I think eating disorders and substance use disorders tend to be a lot more niche. Maybe there's There's a lot more providers in that people may interact with, whether that's therapists or even general practitioners, physicians, dietitians, whoever, that just don't know as much about both of these kind of specialties, whereas a lot of times people are a little bit more familiar with anxiety, depression, some of those other mental health problems, just because they're a little bit more frequent, more common in the general population. And so people get a little more comfortable with that. And then when it comes to eating disorders, substance use, people just may not have gotten a lot of as much exposure to that in their training. And then there's also a lot of medical complications that come along with both that can make people feel a little bit worried about treating those. So I think that going back to your original question, I think that there's a lot of shared risk factors for many mental health and substance use disorders, behavioral health problems, including eating disorders and substance use disorders. And we just wanted to narrow in a little bit more on this particular overlapping group because of the specialization and uniqueness that people may not be as familiar with.
Sure. And is it common for someone to come in maybe to get treatment for substance use or for eating disorder and not even realize that they're dealing with both of these issues?
Sure. And I think that's part of the reason too why it's important for providers to be aware of those increased risks so that we're making sure that we're doing our job by screening and assessing. So for example, myself being a specialist in eating disorders, I would want to be aware of the risk for substance use and make sure that any patient or client that we have coming in is getting screened, that we're asking those questions about their relationship with substances and their substance use history, and that we know at least enough to know when we need to assess further, and then maybe also integrate some interventions and into the treatment from there.
And now, Dr. Maloney, you said that you found that it works better to treat these issues at the same time. Is there an overlap? I assume yes, in the type of treatment that you're doing for both of these conditions?
Sure. I think some of the overlap certainly cognitive behavioral therapy we found works in both, when you treat substance use disorders and eating disorders. As we look at recovery maintenance planning, or other people refer to that as relapse prevention planning, we know that there's overlap there because whether I'm trying to maintain my recovery from substance use or eating disorder or both, I'm going to have some triggers, right? Triggers, whether that be for one diagnosis or another, coping skills, right? How can I cope? What coping skill strategies can I use if I am in a situation where there's alcohol, or I'm feeling a craving to address or to engage in behaviors related to my eating disorder. And so it's important for individuals who enter treatment for substance use disorder. For some of them, we find that particularly if they're in residential care, they may begin to gain weight while they're in treatment. And we want to be able to proactively talk about those things and plan for that so they don't engage in eating disorder behaviors.
And we will be right back. Everyone deserves a chance for recovery. That's what drives Rogers Behavioral Health Foundation. They're helping people get the mental health care they need, from covering treatment costs for those in need, to building clinics where care is hard to find, to funding cutting-edge research. They're making real change happen. And guess what? You can help. Head to rogersbhfoundation.org and be part of creating a future where mental health and wellness thrive. And now back to the interview. When you talked about using substances in order to control your weight, maybe explain what goes through someone's head in this type of situation.
I think there are many ways that different substances can fit into kind of an eating disorder way of thinking, right? So if we're thinking about wanting to control weight, one tactic can be, well, I want to do things that will suppress my appetite, make me feel less hungry, or make me feel more full, or something like that. Another thought process that often goes on is related to, well, I want to burn calories, so I need to boost my metabolism. So there's all sorts of, herbs and supplements and things out there that might purport to boost metabolism, but then there's often lots of beliefs. To what degree they're actually accurate or not is kind of a separate issue, that things like caffeine, amphetamines, whatever will boost your metabolism and therefore burn more calories. And then you can kind of eat maybe whatever you want or eat more than you might otherwise. And then you can kind of burn off the calories through these other substances. So that can be a tactic. Another way that we can also see it come up, and we see this particularly with alcohol use disorder, is if you think about, there are lots of ways that people might compensate for calories that they've eaten. One of those ways is to self-induce vomiting, kind of making oneself throw up to eliminate calories that have been eaten. And drinking is often something that can cause vomiting as well. So there can be sort of this double purpose of drinking, perhaps, to drink to the point of feeling intoxicated, but also maybe drinking so that it will bring up some purging and eliminate calories that have been eaten, including the calories that you get from drinking the alcohol itself. So many different ways that the kind of eating disorder way of thinking can show up in terms of how someone might be using substances to support restricting their eating or compensating for what they've eaten in some way.
Yeah, I think the only other thing I would add is if I started using stimulants in an effort to lose weight, right? We're headed into the summer, and we see a lot of advertisements currently for bathing suits and things of that nature, right? So if I start using stimulants in an effort to fit into my bathing suit, I may start that way. And stimulants, amphetamines, are one of the most addictive substances. So once I start, I may have built some tolerance. And so now I need to continue to use more and more in an effort to maintain, or I may go through some withdrawal, and so I think that is another way that the two can connect. I would also say from a potential commercialization perspective, right, we're seeing different distilleries or distributors, right? They're coming up with skinny drinks. And so there's this idea of combining the two with the alcohol and less calories.
Sure.
And we've seen that increase, particularly during the pandemic.
Oh, let's talk about that. So, was there an increase in all of this during the pandemic then?
I will speak from a substance use perspective. During the pandemic, we did see a increase in particularly alcohol use when there were companies created that would deliver alcohol to your home, right? And so you could order cases and cases of alcohol to be delivered, and people would drink more, right? There was the isolation. And so it was a way to cope with some of those feelings of loneliness. We also saw open container laws being relaxed during the pandemic. And so I think the pandemic certainly had an impact on at least alcohol use consumption. Nicole, do you want to?
Yeah.
Yeah, definitely also saw a big impact on eating disorders. I think some of the biggest reasons for that being that when people were being less active, when they were at home and maybe weren't working, weren't going to school, that is automatically going to decrease, not exercise per se, but more kind of just general physical activity, because we're sitting around a lot more. We're, rather than maybe having specific kind of specified lunch and meal times, we have more food available to us throughout the day, perhaps. So it just changed people's daily living patterns, and that for a lot of folks, and at the time I was mainly working with teens, and I remember so many teens just noticed big changes in a lot of things: their sleep patterns, their eating patterns, their activity patterns, all of these all of these pieces that then affect kind of what happens. And then for people who are more prone to developing an eating disorder, those changes in your eating or your body might feel very, very scary and frightening. And so you feel a need to respond and to get things back under control in some way. And then that really easily sparked eating disorder patterns for a lot of people. I think also it was kind of something to focus on, like you just have more time available. You're not maybe doing as much else with your life. So people could spend a lot of times doing things like counting calories or exercising, or, if you were on social media at the time, so many people were posting exercise routines and dances and all these kinds of things that I think really, again, just created an environment that was a little bit more for people who are already susceptible to engaging in those behaviors, and having them kind of spiral out of control. We're just going to make it more likely to do so. So definitely saw a lot of increases in those behaviors during pandemic, and I think still seeing the ripple effects from that time, even though it's 5 years later at this point.
Right. I was going to say, I'm sure you've seen the effects taper off slightly, but probably not to pre-pandemic levels at this point, correct?
I think it's going to be hard to tell. I'm not even sure we know the full consequences or the full extent to what the pandemic is going to have on our lives 5, 10, 15 years from now.
And we will be right back. Real quick, I wanted to take a moment to talk to you about WISE, the Initiative for Stigma Elimination. It unites people across the nation to support those touched by mental illness and addiction. The compassionate approach champions personal stories and powerful connections, fostering healing by reducing stigma through evidence-based practices. Rogers Behavioral Health supports the work of WISE through their Community Learning and Engagement Department. WISE collaborates with a diverse network of organizations and individuals united in the fight against stigma. You can learn more about WISE, explore their 4 key programs, and connect with them by visiting the website www.eliminatestigma.org. And now back to the interview. So, people that are struggling with eating disorders, substance use, maybe both, is there warning signs that people should look out for?
It's a great question. And I think one of the things that maybe eating disorders and substance use disorders share a little bit is that there's some level of each of those sets of symptoms that's relatively normal and acceptable, right? Like, many people go on diets, and that is not necessarily indicative of an eating disorder. But for many people with eating disorders, that diet is kind of the spark that starts a train that keeps on going to the point where then it sort of is taking over their life and is leaving them feeling out of control and engaging in some behaviors that might be pretty dangerous. And similar to substance use, right? Some amount of drinking, some amount of recreational drug use is pretty acceptable and pretty widespread. And for many people may be relatively harmless, but for some people with those vulnerabilities is really going to take on a life of its own. So thinking a little bit more specifically about eating disorders, I mean, one of the things I really do, if I had to boil it down to one point, I think a lot about when preoccupation, thoughts about food, eating, exercise, your body, when those thoughts and preoccupations with those things takes over your life and is starting to interfere with things that you want or need to be able to do in your life. So a lot of people with eating disorders will find that they're starting to isolate from friends. They're starting to isolate from family. They're spending so much time preoccupied with the way that they look that it's getting in the way of them being able to do activities that were once really meaningful to them. And I think that's a really big, important, broad, overarching warning sign, and a time when it would definitely be useful to seek out some help and support in treatment. And with eating disorders, there's also a medical piece to it as well for many people. So if someone has significantly, for example, lost weight to a point where it is impacting their medical health, it is starting to lead to complications physically, or similarly, if someone is purging to the extent that it's causing abnormalities in their labs and their electrolyte levels to the point where that is becoming a concern, those would also certainly be times that we would want to encourage someone to get support and treatment. Now, people may not always be aware of that though, right? And so then that's also when it's important to pay attention to when things maybe aren't feeling right, making sure that you're going to visit your doctor, making sure to have regular doctor's visits so that you can get those things kind of tracked and monitored and be able to pick up on some of those early warning signs of medical complications as well and be able to address them.
Dr. Maloney, anything from the substance use side that you'd want to add?
Yeah, I think everything Dr. Stettler said, right? Those preoccupations. Am I preoccupied with when am I getting my next substance? How am I going to pay for my next substance? And in addition to that, have I set a limit for myself and unable to stick to it? For example, I'm only going to have 2 drinks. And then I have more than 2 drinks. Am I drinking more than the other individuals I hang out with? Do I have any negative effects, right? Am I, missing work or school or relationships as a result of my substance use? So when I start to think about and ask myself those questions, that might be time to call your doctor, have an assessment, right? Reach out to someone you respect and ask them, right? And really get that assessment.
And then from the other side of that, warning signs that someone should look out for in a loved one.
I think for the substance use side, again, that preoccupation, are they spending more time, focused on substances? Are they getting angry when you say, hey, do you think you're drinking too much, right? Or, can we not drink today, right? And things of that nature. If having those conversations with individuals, I think can be important.
I would say really similarly from the eating disorder side, oftentimes you can notice those changes in behavior as a result of those preoccupations with food, eating, exercise, body image, whatever. So if you're seeing in your loved one a pretty noticeable change in their behavior from baseline, and it seems to really be related to things about food, eating, weight, shape, those would be warning signs to pay attention and to look out for and to ask them about, or try to start conversations from there. I think with eating disorders, similar to substance use as well, there can be a lot of shame, there can be a lot of secrecy, there can be a lot of trying to hide those symptoms. And so sometimes it can be hard for loved ones to notice. And even if you do raise those questions or your observations with your loved one, you might get a lot of denial or, reasons for their behavior that don't have to do to try to alleviate your concerns in some way. But I think continuing to notice and just follow your gut with those observations is really important. With eating disorders, we can also see some other objective signs in the body. Weight is not everything, and we don't want to only pay attention to that. But if someone has a noticeable change in their weight over a short period of time, that is often a big sign for concern. And it may not be, at the very least, we would want to understand what is causing that. If there is like an underlying medical cause, we'd want to understand that and rule that out. But if not, that probably means that there's some kind of behaviors that are contributing to that might be indicative of an eating disorder. So sometimes we can also go off of those changes that we might be able to see that are more visible.
Andrew, I would also add to that, at least for the substance use, if you are concerned that your loved one may have a substance use disorder, whether they acknowledge it or not, I encourage every family, friend, individual to carry Narcan, because Narcan is now available over the counter. You can get it at your, local pharmacy. And having it could potentially save the life of someone, maybe a stranger, maybe a family member, maybe a friend. But there is never any harm in individuals carrying Narcan.
Good advice. Dr. Maloney, any advice for someone struggling who realizes they probably need help? What's the next step for them?
Sure. I would encourage them to reach out to either a trusted individual, whether that be a friend, their primary care physician. Here at Rogers, we offer free screening. It's important to begin to have those conversations. So, whatever that individual needs to feel comfortable to take that first step.
Dr. Stettler?
Really the same thing. I think that that's really key, is reaching out to whoever you're most comfortable to take that first step with, whether that is a professional that you're working with or that you can access, whether that is a loved one who can support you. Rogers also offers and has the ability to do screenings for eating disorders as well, and to help kind of connect to resources. There are also other organizations within the eating disorder space, like NEDA, NEDA. You can learn more if you're not maybe ready to talk to an individual yet, but you just want to learn a little bit more, or do some kind of maybe screening that will give you information, but not share it with anyone else yet. Those are also resources that are available and can be helpful first steps to take. But really just taking that first step in whatever way is going to feel doable in that moment. It's the most important thing.
Great advice. Dr. Stettler, Dr. Maloney, thank you both so much for joining me today.
Thank you for having us.
Thanks so much.
Well, listener, if you're anything like me, you thought multiple times during that interview that the answer for the question was the same for both eating disorder and substance use. And I guess when I think about it, that shouldn't be much of a surprise. An eating disorder kind of is an addiction, isn't it? Much like substance use, right? So, with that being said, thanks again for listening to Rise Above, a podcast from Rogers Behavioral Health. If you know someone who you think should listen to this episode, please feel free to pass it along. Be sure to like and subscribe to be notified of new episodes. And as always, if you or someone you care about is struggling with a mental health or substance use disorder, visit rogersbh.org for a free mental health screening.